find most patients are responsive and just so appreciative that you're able to see them during this crisis. So the big things are, it can be difficult technologically. So for someone who's just not techie, it's a little bit difficult. We have a great IT team here at Barrow, so they've been able to actually pre-call patients, guide them through the setup, and that's made things a lot smoother when it's time for the visit. And we also have backups where, let's say the audio is not working, we'll have them on a phone call while I have them with the visual from the actual Zoom video. So that's some of the workarounds that we've had. And patients have been really patient and really great. And I've even troubleshooted with some patients, I can't hear you, let's try this. Are you on the right screen? And it's amazing, what people, can figure out. And I have people of all ages. Often people are like, oh, but what about our elderly patients? Some of my best ones are my elderly patients. They're fantastic. The hardest is if they're hearing impaired. So you do often have a chat box that you can do, but that is quite difficult. What I had yesterday for someone who is hearing impaired is her daughter was there. So her daughter was able to speak kind of loudly to her, repeat, and help her get through that. So that was really helpful. I haven't had anyone with a significant visual impairment yet, but the most important thing with the video when it comes to exam is that you're able to see the patient. So if they do have the video, while they may have a harder time telling you where it is that the video is placed, you'll be able to see and hear them and at least try to get that assessment. They may not be able to connect with you visually as well as they might in person, depending on the degree of their visual impairment, but that is a bit more difficult. I've even done with translators. So I've had a translator come onto Zoom and we have a 3-way video chat. And I have someone translating for someone in Spanish since I don't speak Spanish. So, I mean, a lot of the things that are barriers, we can get around. We have some patients who just aren't interested. And we kind of tell them, this is what we're doing right now. We can't safely see you in person. So, I mean, you can reschedule, but we can get you through this. The biggest limitations are if we have someone who they absolutely don't have, any access to internet and they don't have a device. In those cases, I've done a visit at least over the phone for in the meantime to get them through this time. So a lot of people are doing this from home. So number one, don't see patients in your pajamas. And, you want to also make sure your patients are dressed. We've had at least one provider had to tell the patient to put on some pants. So you do want to think about professional and that interaction with the patient. I'm at work right now, so I've got a great background here at work where I've got a nice simple wall behind me. You don't want to have a really cluttered, messy space. You don't want to have a bunch of food that you're sitting there eating. And then think about your lighting as well. So I'm great. I have a window here in front of me, so I've got some nice natural lighting. You want to be careful about a window being behind you because backlit might actually cause some glare. And for instance, where I'm seeing patients with migraine, that glare can actually worsen their photophobia. So you want to consider all of those types of things. I've also noticed, for instance, I often wear my hair up. It looks really messy and catches the light and it looks unprofessional. So I've been trying to wear my hair down or in hairstyles where you're not going to see that frizz as much. So just consider how things look on video in that way. In terms of other etiquette, so let's say I have multiple screens in front of me, which is true for my setup. So I have a screen here, and actually I've got a laptop over here. So let's say I have the patient on this screen, but I'm checking something over on their EMR. So, and it could be a very legit reason to be looking away. It looks really rude if I'm doing this and talking to the patient. It looks like no eye contact. So you want to tell a patient when you're doing that, or if you're taking notes and you're looking down, let them know that it's that you're taking notes and you're not sitting there also playing with your phone. And we're really prone to looking at our own video. So if you can, put the video up at the top middle of your screen. That way, if you keep looking at yourself, you're actually looking at the camera and it looks like you're actually maintaining a better eye contact. That or another thing that I saw as a suggestion, if you can't move where your picture is, put little googly eyes or something that distracts you and makes you look up towards where the camera is. So you really want to consider that eye contact.
Again, it seems a lot of this almost is just kind of getting creative and thinking outside of the box.
It really is, yeah. Another thing to think about too is lag. So I'm not always great about this, and sometimes you will have to interrupt your patients because there is that lag. But you want to think about if you are trying to wait for them to be finished, give themselves a couple seconds before you jump in, because that time difference may not be appropriate, and you don't want to be cutting off a patient unless you're purposely trying to redirect them.
Mm-hmm.